Hey everybody, it's Matt and Don. Welcome back to OK Aussie. We do have Maximus, he's just over there,
He's
and
our
Willow's
support cat.
in the background.
Willow's there.
In today's episode, we're actually going to talk about the FCA, the Functional Capacity Assessment, that's been done by an OT, an Occupational Therapist, for the NDIS, the National Disability Insurance Scheme.
Year by year.
Now, this is part of a submission that's been used for and to the NDIS as part of a urgent change of circumstances, a COC. Don't know if I like that acronym. But anyway, that was submitted in
COC.
January. In February, there was an escalation from the hospital, and subsequently from there, life got a little bit shitter because things got lost within the NDIS. That's another story separate to that.
The computer went.
But when we're doing submissions to the NDIS, there is a lot of paperwork, a lot of reports, a lot of assessments, a lot of time from professionals.
For people who are medically complex, absolutely.
Yes, exactly. I'm talking about ourselves and our experience. Everybody is different.
Yours is easier.
I hope so.
I do
Fingers
hope that.
crossed.
But if yours is complex too,
so today's exercise is to actually share just simply the functional capacity assessment. That's a 69.
Is it alright if I put the fan on?
74-page document. I'm going to read through that. There is a detailed nursing report, continence report, continence and clinical nursing recommendations. There is a bowel and bladder diary. There is a assessment report. There is a carer's statement and impact report. There is a housing provision report. There is a support provider report. There's also a support coordination report.
Report.
Bloody hell! You think that it's like reading War and Peace.
A novel.
And the funny thing is, most of the time is they don't actually have the time to read War and Peace. But anyway, I'm going to give you an insight today, and it's useful for Dyan to also be refreshed as to what the OT.
And we can measure this as the years go on.
Yeah, for a change.
We know where I'm at.
Think of it as pre and post testing.
I'm not expecting improvements, but I can be hopeful.
Now, I'm just going to read through it because I'm going to go very, very fast, and you can comment over the top of me and whatever else, but I'm just going to keep reading it through. Yes. So, Occupational Therapy, Functional Capacity Assessment Report. This is done by an OT. Dyan's a very qualified OT from Revolution of Wellness. Background information, Dyan Moore is a 51-year-old mother of two adult sons, aged 30 and 28, who no longer reside at home. She's been married to Matt for 33, now 34 years, who serves as her primary carer. In July 23, Dyan underwent genetic testing and was diagnosed with 22q11.2 Deletion Syndrome by Dr. Catherine, a geneticist at Genetic Services WA, based at the King Edward Memorial Hospital. This chromosomal disorder is the underlying cause, an umbrella, of many of her comorbid conditions, affecting multiple organ systems and significantly impacting her functional capacity. Her key NDIS recognised diagnoses include, and remember there is a difference between what the hospital has on file and what the NDIS recognise and understand, because they also have their own differing table and categorizations. They've gone from symptom-based to having diagnosis-based information, and it helps them to formulate what your needs happen to be. So Dyan's key NDIS, National Disability Insurance Scheme, if you're not in Australia, that's the Australian Disability Service run by the government. It looks after and cares for people under the age of 65 with disability. After that, they go into the
ACAT not even means
aged
tested,
care
actually.
system.
It's just for every Australian.
So your key NDIS recognised diagnoses include severe myalgic encephalitis, ME, chronic fatigue syndrome, CFS, postural orthostatic tachycardia syndrome, POTS, Ehlers-Danlos syndrome, hypermobility, EDS, autism spectrum disorder, ASD, attention deficit hyperactivity disorder, ADHD, fibromyalgia, gastroparesis and dysphagia, dystonia, autoimmune disease, unspecified seizure disorder, including tonic-clonic, absent myoclonic, and dystonic seizures, which often escalate into status epilepticus, requiring emergency intervention. There are other things that obviously they don't list amongst all that, but that's on the next page. Additionally, medical information and reports have been provided by the hospital and details further conditions which impact her daily life, her being Dyan, when I say that in context. Lupus, Lyme disease, dysautonomia, hypertension, multiple chemical sensitivities, MCS, mast cell activation syndrome, MCAS, irritable bowel syndrome, IBS, pelvic inflammatory disease, PID, polycystic ovary syndrome, PCOS, obsessive compulsive disorder, OCD, dyslexia, auditory processing disorder, alexithymia, Tourette syndrome, anxiety and complex post-traumatic stress disorder, CPTSD, thermodysregulation dysfunction, which leads to extreme sensitivity to environmental temperatures
PTSD.
and increased risks of seizures. Okay, so this helps to paint the picture when people from the NDIS, the teams, the supports are reading through this to understand what is it that Dyan's got as a condition.
Not helping.
Dyan's functional ability is significantly impacted by 22q11.2 deletion syndrome, which is the underlying cause of many of her comorbidities. This genetic disorder affects multiple body systems, leading to complex medical needs and functional impairments. Seizures, dystonia, chronic fatigue are among the most debilitating symptoms, severely limiting her ability to be independent. Dyan experiences frequent tonic-clonic and absence seizures, with episodes sometimes escalating into status epilepticus, which can be life-threatening. These seizures often result in prolonged recovery periods where she experiences confusion, fatigue, and physical pain, making daily tasks and mobility challenging. Additionally, Ehlers-Danlos syndrome, EDS hypermobility, contributes to recurrent joint dislocations and chronic pain, significantly impairing her physical stability and functional mobility. Dyan's independence is further impacted by postural orthostatic tachycardia syndrome, POTS, and myalgic encephalitis chronic fatigue syndrome, MECFS, leading to severe fatigue, dizziness, and orthostatic intolerance. She is mostly bedbound, spending up to 23 hours per day in bed, with very limited ability to move independently on a bad day. She relies on a wheelchair for mobility and requires assistance with all aspects of personal care, including showering, dressing, and toileting. Cognitive challenges due to autism spectrum disorder, ASD, ADHD, and sensory processing difficulties further complicate her daily activities, requiring structured environments and specialized support. The combination of thermoregulatory dysfunction and mast cell activation syndrome, MCAS, also makes her highly susceptible to environmental triggers, further restricting her independence. Due to the severity and complexity of her disabilities, Dyan requires continuous 24/7 support for all aspects of daily living, including personal care, mobility, medical management, and emergency response. She currently lives in a specialist disability accommodation, SDA, however, does not have sufficient funding to meet her needs and to ensure she can receive assistance in case of sudden medical crisis such as seizures or dystotic storms. Her dietary needs are managed with textured modified food and hydration support, as swallowing difficulties and gastroparesis pose a risk for aspiration and malnutrition. Given the progressive nature of 22q11.2 deletion syndrome, ongoing management and specialist interventions are required to maintain her current level of function and prevent further deterioration. Recent hospitalisation. Dyan's recent 6-day hospitalisation, discharged on the 7th of February 2025 in the neurological ward at Fiona Stanley Hospital, FCH, highlights the severe and multi-system impact of 22q11.2 deletion syndrome, which underlies her complex and deteriorating medical condition. She was admitted through FCH emergency department under a code blue, experiencing 9 seizures on the first day alone, alongside recurrent oxygen desaturation, SpO2 dropping 83%, heart fluctuations from dangerous spikes above 160 beats per minute to critical drops as low as 33 beats per minute, and persistent angina episodes requiring GT and nitrolingual spray intervention. As 22q11.2 deletion syndrome affects neurological, cardiovascular, autonomic, and immune function, Dyan's daily seizures, dystonia, dysautonomia, and POTS-related instability significantly limits her ability to self-manage care and requires continuous monitoring. Her swallowing difficulties, gastroparesis and aspiration risk, common complications of 22q11.2 deletion syndrome, necessitated constant supervision during meals as she is unable to eat safely or independently navigate hospital food ordering due to her dietary restrictions and multiple allergies. Cognitive impairment, autism, and interoception issues are also associated with 22q11.2 deletion syndrome, meaning that she is often unable to express pain, hydration, or toileting needs, requiring full-time advocacy and medical decision-making support. She remains at high risks of falls and in need of 24/7 supervision, having suffered 2 significant falls within 24 hours. Despite a chronic multi-drug resistant Klebsiella UTI, a consequence of immune dysfunction and autonomic bladder issues linked to 22q11.2 deletion syndrome, this infection remains unresolved, causing severe pain and requiring assistance to toileting up to 20 times per day. During the admission, Matt had to manage all medical interactions, medication delivery, and neurological event logging. The ongoing systematic impact of 22q11.2 deletion syndrome across multiple organ systems, coupled with insufficient hospital and home supports, necessitates urgent additional daily support staff for 16 hours per day, 7 days a week to ensure her safety and prevent further deterioration. It lists then height and also weight. This is to paint the picture, understanding what Dyan struggles with her health concerns, hospitalisation engagement, and how she has to survive therefore in the community, and the request towards 24 hours a day, 7 days a week, monitoring, constant supervision, because at any time of the day, end or
I've
night.
done really well, but we've done too well.
Yeah.
For too long.
Now, there are also goals that the NDIS looks at in the short and mid-term, and there's 4 goals that are listed, and these are goals that they need to look at trying to provide supports and resources to help her Dyan move towards, and understanding goals helps other providers understand where we're aiming towards in the short term. Goal 1, to increase my time out of bed, the bedroom, the apartment, over the next 12 months, at a minimum of 3 times a week,
good.
ideally, to encourage ambulatory short distance movement within my physical capability, to independently access my apartment via small accessible powered wheelchair, to sit outside on the patio, and to access my apartment building facilities, including increasing my frequency of creating resin artwork with potential of exhibiting or selling my completed artwork, as well as growing my YouTube channel, that's you guys, towards monetization with potential of creating a small supplementary income. Goal 2, I want to increase my level of independence over the next 12 months to leave my apartment at least twice weekly in a suitably small accessible powered wheelchair, to go to the mailbox, to do the bin chute, access my apartment building facilities, and to visit other people.
If I can remember how to use the lift.
I understand. To be able to go to the shops along with the primary carer to buy essential personal items that I need for myself and shop independently, or attend medical appointments. Goal 3, I want to increase my ability to independently, frequently and consistently safely bathe and shower, as well as wash my hair more often, as much as possible, including being able to dry and brush my hair independently at a minimum of every second day, to improve hygiene, to improve personal presentation and participation in social activities, reduce infection risk, reduce bed sore risk, relieve muscle and joint pain, soothe irritated skin, and improve sleep. In goal 4, I want to understand my disability and the impact that they have on my life so that I can manage my symptoms and overall condition effectively, increasing my function, improve my confidence, reduce the intensity, frequency and triggers to seizures, Tourette's, anxiety and autistic meltdowns. I want to build healthy long-term connections to my community and build safe, independent friendships through access via my wheelchair.
I don't know if that's going to happen though.
No, and look,
I think that the OT knows it too, but
Yeah.
I think that it's always good, guys. So set goals anyway.
set goals.
Just don't punish yourself if you don't make it. The fact
No.
that you get up every day, put a smile on your face, and you just, through whatever it is, a seizure or whatever you're going through, you just soldier on, then you're kicking it.
Absolutely, and I
about
think
it.
you're kicking it every day, and that's incredibly important to actually state as well, because
Yeah.
there's got to be some reality and understanding too that Dyan's got a deteriorating
And
condition,
OTs
as
do
they've
know that.
noted that.
Yeah.
We aim high, but you know what,
We
we're
aim
also
high, see
realistic.
what happens.
Here's some of the assessment outcomes: functional domain, the current situation and what performance was noted, support, informal supports. So, me, Matt, Dyan's husband and full-time carer of over 30 years, presents with a significant carer burden due to the complex and high levels of care needs of Dyan. His physical and mental health have been severely impacted due to prolonged caregiver stress. A recent
Care
support
abuse.
letter from Matt's doctor highlights several serious health concerns, including tension headaches, hypertension, migraines, a renal infarct, spondylosis
Multiple
lumbrosacral,
times.
Morton's neuroma in the right foot, extensive tendinopathy, and flexor tendinopathy in the elbow. These conditions have been exacerbated by the intensive manual
being a carer.
handling required in Dyan's daily care.
Yeah.
Matt also suffers from right elbow tendonitis requiring cortisone steroid injections. I think I've now had 8. Recurrent subluxations of the right shoulder, left knee medial collateral ligament MCL damage, pending surgical repair, all of which have worsened due to prolonged caregiving tasks.
Correct.
His musculoskeletal injuries are further aggravated by physical transfers, personal care responsibilities, and the need to provide manual massage due to Dyan's intolerance to certain medications. The physical toll of caregiving has been compounded by a previous knee injury sustained while manually evacuating Dyan during emergency, emphasising the urgent need for increased formal support. Beyond his physical health, Matt experiences chronic stress, emotional exhaustion, and high levels of anxiety, placing him at risk of caregiver burnout. He continues to delay
You're
and
already
put
there.
off urgent medical interventions, including surgery, due to the lack of adequate
Correct.
formal support for Dyan currently. The ongoing emotional and physical strain has resulted in deterioration of his overall well-being, leading to social isolation, estrangement from family, and no time for his own friends or hobbies. The psychological burden of managing Dyan's complex disability needs without respite has left him mentally and emotionally depleted, with little to no opportunity to focus on his own health, interests, or social connections. The relentless demands of caregiving, combined with inadequate external support, have made it nearly impossible for Matt to maintain any form of a work-life balance, further exacerbating financial and emotional strain. If
Correct.
the current lack of support continues, there is a significant risk of Matt becoming unable to continue his caregiving role, which would jeopardise Dyan's stability and increase the need for more intensive formal supports. The long-term sustainability of her care is directly dependent on increasing structured support for Matt, as his declining health threatens both his ability to provide informal care and Dyan's long-term well-being. Urgent formal supports is required to prevent caregiver breakdown, ensure Matt's ability to maintain his health, and safeguard Dyan's access to consistent, high-quality care. That was because of also an urgent submission in January. We're now
Yes.
in mid-September.
September.
Nothing's changed. 6 years ago, I could have read the same thing. Nothing's changed. Just pointing that out. Friends and family. Dyan and Matt have 2 adult sons who are estranged and don't keep in touch. Matt's sister visits once every 6 months, and there are no other family members or friends actively involved in Dyan's care.
Due to what?
The absence of a support network.
Due to what? Disability.
Yeah, exactly.
So NDIS informals, if you don't incentivize them, they have to support themselves.
Great.
They
And
don't
the
have
NDIS
ability.
actually wants and needs this information because they actually look to
Then
the
you need to
informals,
pay
your neighbours, the
carers,
community,
your
the
family.
churches to
There's
support
no
you
other
first
way.
before the government
People have
steps
to earn
in.
money.
Yeah.
Fact.
The absence.
You made it that way, government.
Yeah, the absence of a support network places additional strain on Matt, who manages all aspects of Dyan care independently. The increased NDIS formal support planning for Dyan has seriously considered the lack of informal supports, acknowledging that it's unreasonable.
Yeah, because they got burnt out.
Yep, it's
And
unreasonable.
and none of it's my fault.
No,
But this is Australia.
this is Australia dealing
This is
with
Australia.
people with disability. So, acknowledging that it's unreasonable to expect Matt to continue providing this level of care without assistance. The report emphasises that Matt's physical and mental health have deteriorated due to his caregiving role, making the inclusion of formal supports essential to ensure Dyan's needs are met while safeguarding Matt's well-being. Increased NDIS support has been justified on the basis that families, informal networks and the community cannot be expected to meet the high-intensity care Dyan requires. This aligns with the NDIS guidelines that account for what is reasonable to expect from informal support systems and underscores the need for sustained formal assistance to prevent caregiver burnout and ensure quality care and safety for Dyan. Formal supports. Dyan requires extensive formal supports for both assistance with daily living, ADLs, and assistance with social and community participation due to the wide-ranging and systematic impact of 22q11.2 deletion syndrome on her functional abilities. As a multi-system genetic disorder, 22q11.2 deletion syndrome contributes to muscle weakness, poor motor coordination, frequent joint dislocation, immune dysfunction, sensory processing challenges, cognitive impairment, complex neurological symptoms, all of which significantly reduce her ability to manage daily activities independently. The neuromuscular impact of 22q11.2 deletion syndrome leads to low muscle tone, postural instability, and frequent falls, which are further exacerbated by severe MECFS, Ehlers-Danlos syndrome, and cerebral ataxia. Without adequate support, these conditions increase the risk of serious injury and hospitalization due to falls, seizures, or autonomic instability. Dyan's frequent tonic-clonic seizures, dystonia, and autonomic dysfunction require constant assistance for mobility, transfers, and all daily tasks to ensure her safety. On good days, she requires standby assistance for transfers, and on bad days, she requires moderate to maximal physical assistance. Compromised immunity linked to 22q11.2
Except when it
deletion.
gets to night time and I have to be carried to the
You
toilet
literally got to
every
be
single
carried.
night.
Yeah, exactly. Compromised immunity from 22q necessitates strict infection control routines, including daily hygiene, cleaning, and personal care to prevent severe infections. Sorry, you got an infection right now. Particularly as she battles a chronic multi-drug resistant Klebsiella UTI for 4 years. This requires daily to once every 2 days of sheet cleaning, frequent changes of clothes, daily laundry. Cognitive impairments include memory deficits, executive dysfunction, interoception issues, making it impossible for her to manage medications, plan tasks, or recognise her own care needs. Without structured support, Sensory sensitivities and neurodevelopmental traits associated with autism and Tourette syndrome further impact her ability to engage in social environments without assistance, limiting her independence. Formal supports are critical not only for basic care but also for Dyan's ability to pursue her NDIS goals, which focus on increasing her independence, accessing her community, and engaging in meaningful activities such as attending medical appointments, managing daily self-care, and participating in recreational pursuits like resin art or YouTube content creation. Without structured assistance for personal hygiene, medication administration, compression stocking application, cleaning, laundry, and meal preparation, Dyan will be unable to maintain her health or progress towards greater autonomy. We have, unfortunately, just as a sub-note, not now been able to engage any further with the hospital and clinics. She's under 24 different specialists. We don't have a tilden-space wheelchair. We cannot get Dyan safely to the hospital. We can't travel her safely because I don't have a nurse to travel with me. We don't have medical oxygen cylinders to deliver appropriate oxygen. We don't have a defibrillator to be able to life-savingly keep her alive.
I should have just been a smoker and I would have just been given it.
I know, it is crazy.
I should have just said, oh, I smoke, even though I don't. I should have said it.
A lack of adequate formal supports places Dyan at high risk of failing to achieve her NDIS goals, experiencing increased medical complications and requiring more frequent and prolonged hospitalisations. The goal should be to keep Dyan out of hospital, safe in the community.
That's the goal.
Given the progressive nature of 22q 11.2 deletion syndrome and its associated complications, the absence of daily structured support not only reduces her quality of life, but also increases the long-time burden on emergency medical services. Ensuring consistent, high-quality support is essential to prevent further deterioration, promote stability, and enable Dyan to live as independently and safely as possible within her capabilities. Although Dyan and Matt have expressed gratitude for the specialist disability accommodation they currently reside in and the availability of staff in close proximity, the insufficient funding limits the level of support that can be provided, leaving significant gaps in Dyan's care. We have not had formal supports in place now for 2 months.
I'm not sure.
I'd say it's been 8 weeks.
Roughly 2 months.
No,
so basically,
daily supports.
We can't align it up yet because I don't have the high intense care needs.
Correct.
Pay scale to pay more qualified staff. So
correct, and that's required us to do escalations to the NDIS
I can't
ministers,
do anything about that.
the NDIS complaints, safety and quality guidelines, senators.
Yeah.
As a result, Matt has been experiencing extreme carer burnout. Hey, there's different levels. I've got extreme, I've got ultimate, I've got you're dead. You know, when they say you're burnt out, I think I'm fried, crispy, and
You're crispy.
well done.
You're crispy.
So as a result, Matt's been experiencing extreme caregiver burnout, averaging only 3 to 4 hours of sleep per night. I'm sorry I keep falling asleep every day. I'm just so tired.
Yeah, I know. It's because of the no carers.
Yeah. And I have been. And Dyan's a bit frustrated at that, and that's okay as well. But I'm just exhausted. Yeah. If lucky, due to the ongoing complexities of Dyan's care, the current care arrangements is neither reasonable nor sustainable for Matt, who is already experiencing severe physical and mental strain. Increasing formal support funding would not only alleviate the burden on Matt, but also reduce the frequency of crisis situations, emergency hospitalisations, and preventable hospital admissions. Investing in adequate daily supports will improve Dyan's long-term health outcomes while ensuring both she and Matt can sustain a safe and functional living arrangement. Another critical gap that must be addressed is the need for proper support worker training. Given the complexity of Dyan's medical needs, support workers require specialised training in managing seizure first aid and emergency response, dystonic storms, autonomic dysfunction, infection control practices for catheter care, cognitive support strategies for executive dysfunction, sensory regulation techniques for autism and Tourette syndrome, and safe manual handling for mobility assistance. Without adequately trained support workers, there is a high risk of care errors, increased hospital admissions, and preventable medical crisis. Many current support staff lack the necessary expertise to manage a medically complex client like Dyan, which places...
It's no one's fault. Like, there's so many good support workers, guys. I just want people to know that. If you're a support worker watching this, or you've got support workers, I'm not criticising anyone that's less qualified. It's a bit like you got enrolled nurses and you got registered nurses. They're all valuable. It's just that I need to stay alive because of the risk factors at a qualified medical.
Yeah, and this has now been clearly identified by multiple
for the carer
professionals
as well,
at the end of the day.
It's safer for the carer. Like, I would not want to put a regular carer in this position and I die on their shift and they get pulled into coroner's court. I'd feel terrible.
Yeah, please note this places additional strain on myself as the primary carer, who often has to intervene to correct or guide the staff Properly
Your
trained
body's shifting
support
all the
workers
time.
would require reliance on informal support, improve the effectiveness of care, and provide a more sustainable long-term support structure for Dyan and Matt. Addressing these training gaps must be a priority to ensure Dyan receives the high-quality specialised support she requires. The report below will continue to illustrate why and how Dyan requires extensively high-intensity support from trained support workers to ensure her health, safety, and quality of life, just to keep you alive. So it's been clearly documented, those needs from the outset. Mobility and physical capacity in the home. At home, Dyan's mobility is extremely limited, with her spending up to 23 hours per day in bed due to severe fatigue, pain, and neurological instability, all of which are directly linked to the multisystemic impact of 22q11.2 deletion syndrome. As a genetic order affecting muscle tone, coordination, autonomic regulation, 22q contributes to significant mobility challenges, exacerbating the effects of her co-occurring conditions such as POTS, MECFS, Ehlers-Danlos syndrome, and cerebral ataxia. She can only stand for short periods, up to 3 minutes, before experiencing dizziness, orthostatic intolerance due to POTS, and autonomic dysfunction, further limiting her ability to move independently.
If I exert myself, I have a seizure.
Bingo. When moving within her home, she can only take very short distances, such as transferring from the bed to the stool to the ensuite toilet. But even this requires significant exertion and careful pacing to avoid triggering post-exertional malaise, seizures, or autonomic instability, which are common neurological manifestations of 22q11.2 deletion syndrome. I have to also point out that all of the clinical staff that have written reports for Dyan have had to actually research, have had to go to all the clinical guidelines, the internationally available clinical guidelines, and the available peer-reviewed medical journals for 22q to compile research and information and facts which are specific to Dyan's known genetic condition.
They're like, I don't have time.
So everything that's stated in here is actually per the clinical guidelines for that condition. On good days, Dyan may manage a standing transfer with standby assistance, such as to the toilet or balcony, but on bad days, she requires moderate to maximal physical assistance for all movements, including getting in and out of bed, repositioning, transferring to a wheelchair, accessing seating areas. She currently has a hoist to assist with transfers on really bad days. However, due to the fluctuating and progressive nature of symptoms associated with 22q, including muscle weakness, chronic fatigue, and autonomic instability, Dyan remains dependent on support workers and her husband for mobility, transfers, and activity of daily living throughout the day. Standby supervision is required at all times to prevent falls, which requires a significant risk due to postural instability, dysautonomia, dystonia, and impaired motor coordination, even on a good day. This is why we even have things such as the crash helmet, because Dyan can have atonic drop seizures, trip over, and when she falls, she falls. It's literally
I only get up when I really can, and I have to.
And she talks about this right now. Dyan's risk of falls at home is very high, particularly due to the neuromuscular and autonomic impairments associated with 22q11.2 deletion syndrome, poor postural stability, muscle weakness, dystonia, and cerebral ataxia, all of which were recognized complications of this genetic disorder, further contribute to her risk. She has already experienced multiple recent falls, including 2 significant incidents within 24 hours. Highlighting the urgent, I know we still need to get your CT scan done of your wrist, highlighting the urgent need for additional formal support to prevent further injury. During the occupational therapy assessment, Dyan required 4 trips to the toilet within a span of an hour. Backwards, forwards, backwards, forwards, backwards, forwards, backwards, forwards, reinforcing the critical need for 24/7 assistance to facilitate all transfers safely. Without constant supervision, these frequent movements and significantly increase her falls risk and place excessive strain on her primary carer, Matt, who is already experiencing extreme burnout. Community. Community access is vital for an aspect of Dyan's overall well-being and closely aligns with her NDIS goals of increasing independence, building social connections, and engaging in meaningful activities.
Wonderful.
Currently, Dyan uses her manual wheelchair for community outings. However, her severe mobility limitations, frequent seizures, dystonic storms, autonomic instability, and significant fatigue make it difficult for her to manage independently. That causes cardiac, it causes respiratory, it causes seizures.
It's not
even
fair.
With the manual wheelchair.
It's not fair.
She relies heavily on Matt for propulsion, transfers, and supervision during outings, which further contributes to his carer burden. Additionally, Dyan experiences sensory sensitivities and becomes overwhelmed in shops, requiring support from individuals who understand her complex needs. Although she currently attempts to go out once a week, she would like to increase her capacity to twice a week with appropriate supports in place. You haven't actually been out of the home for 2 weeks straight now, have you?
More than that.
More than that?
Because of my UTI, guys,
Yeah.
it has knocked me fatigue-wise, it's knocked me pain-wise, it's knocked me
So it's
with
gonna
frequency, it's knocked me in so many different ways that I haven't been out in weeks.
There's been then at least 3, coming up to maybe 4 weeks.
Was it the last outing, my doctor's appointment?
Well, that's right. So it's been
Yes.
3.5 weeks then. So 3.5
Wasn't
weeks.
it more than that?
No,
Wasn't he
3.
away for 4?
No, 3.5 weeks.
Okay, 3.5 weeks. There
3.5
you go.
weeks
And
since
that,
Dyan
as you saw,
has left this apartment.
you saw on video.
Yep.
Me going to the doctors, and I was like, not well.
Not well.
I was really bad.
Just wanted to put that in context so that you're aware of her houseboundness or bedboundness. To enhance her ability to access the community safely and independently, Dyan requires an upgrade to a powered wheelchair. Once the trial is successful, Dyan requires a powered wheelchair to reduce reliance on Matt for mobility and enable her to navigate public spaces safely and independently. This upgrade is crucial for conserving her energy, which is limited due to chronic fatigue and POTS.
I struggle to drive it quite often, guys. I use him pushing me in the push wheelchair because I've gotten that bad.
For your cognition.
The electric wheelchair is only when my cognition's good.
Correct. Now, since this report was written, prepared and submitted in January, there has also been a subsequent additional AT submission, assistive technology submission for a TIS, a tilt-in-space wheelchair. The OT has recognised the need, and particularly with the frequent hospitalisation and clinic appointments. Dyan's 85% having seizures and events within 5 minutes of going to a hospital.
We bought one
6,
before
7
we
years
got
ago.
on the system when we were privately funding them.
Correct. So that's something which is applied as additional application, which is all part of this change of circumstances to get a wheelchair that can literally tilt for orthostatic intolerance and go flat.
Max.
I can manage seizures, cardiac and respiratory issues in place. Sorry, Maximus being Max.
Max is just
train support workers for community outings. Dyan needs trained high-intensity support workers who are skilled in managing complex medical emergencies, including seizure response, dystonic episodes, ensuring her safety during outings. These workers must also understand her sensory needs, help her navigate environments that may be overwhelming and provide reassurance during social interactions. So they need to be autistic aware.
Yes.
Safe transportation options. Accessible transportation that accommodates Dyan's wheelchair and medical needs is essential. Transport options must ensure she can attend medical appointments, therapy sessions and community activities without risking her health. Supported access to community-based activities. Dyan wishes to participate in hydrotherapy sessions, resin art exhibitions and creative workshops, aligning with her goal of increasing participation in meaningful activities, reduction in risk of social isolation and the potential for income generation through art sales. And that's right. That's where these things can be dynamic and can change your goals. You've done an exhibition already. You have learned that you don't have the energy to be able to sit up and do lots of art, unfortunately. It's just not realistic.
But I did realise now that I look back at it, it actually is something that was above my ability. But that's okay. People don't, when they get to know you first, they don't know you straight away.
No.
It takes a long time to get to know people, and that's just life. But my focus is really YouTube.
100%.
Because it's within my boundaries.
Within your scope of capacity.
Even if I'm feeling crap, I can normally find half an hour to 40 hours, 30 minutes to 40 minutes a day to talk to you guys.
100%.
So yeah.
Falls. Dyan is at a high risk of falls due to multiple compounding factors associated with 22q11.2 deletion syndrome and co-occurring conditions, including EDS, Ehlers-Danlos syndrome, POTS, postural orthostatic tachycardia syndrome, ME/CFS, myalgic encephalitis chronic fatigue syndrome, dystonia, seizures, and autonomic dysfunction. Her poor postural control, frequent syncope, joint instability, and muscle weakness creates an unpredictable risk of fall, even when using assistive devices like grab rails or manual wheelchair. Additionally, her dystonic episodes and motor tics from Tourette syndrome may cause sudden, involuntary movements, leading to increased risk of injury, losing balance mid-transfer or while repositioning. Dyan has experienced frequent falls, including incidents where she has collapsed due to sudden or tonic crashes or seizure activity, highlighting the ongoing and urgent need for continuous supervision and hands-on assistance. On some occasions, she has sustained injuries, including bruising and joint pain, following these falls, further exacerbating her chronic pain and her mobility challenges. Despite efforts to mitigate risks through environmental modifications and mobility aids, her seizures, syncope, and postural instability remain unpredictable. Given these factors, constant standby assistance is required to prevent injury and ensure immediate intervention when necessary. Without adequate formal support, Dyan's risk of serious injury, prolonged recovery periods, and emergency hospital admissions significantly increases, ultimately impacting her ability to achieve her NDIS goals of increasing independence, accessing the community, and participation in meaningful activities. Additionally, the burden of managing fall-related risks continues to place excessive strain on her primary carer, further emphasising the need for increased formal support to ensure both Dyan's safety and long-term stability of care.
Sorry.
No tissue? It sometimes
It's
hits you,
just-
doesn't it?
Yeah, like I'm losing
Losing
what
function.
people lose in elderly years, and I'm losing it now.
Exactly. Pain. Dyan experiences chronic, severe, multifaceted pain, significantly impacting her daily function, mobility, and overall well-being. Her pain stems from 22q11.2 deletion syndrome and its associated comorbidities, including EDS, fibromyalgia, dystonia, scoliosis, autonomic dysfunction, chronic infections, and neuropathic pain. The clinical nursing assessment confirms that her pain is constant but fluctuates in intensity, with baseline levels of 5 out of 10 on good days, reaching 8 out of 10 or higher on bad days. Types of pain and contributing factors. Musculoskeletal and joint pain. Dyan's EDS, Ehlers-Danlos syndrome, a hypermobility disorder, connective tissue issue, leads to frequent joint dislocations, chronic musculoskeletal pain, and widespread connective tissue dysfunction. Scoliosis, curvature of the spine, and multiple spinal impingements contribute to persistent lower back pain, exacerbated prolonged bed rest, and muscle deconditioning. Temporomandibular joint dysfunction, or the TMJ joint, results in jaw pain, facial tightness, and difficulty chewing, worsened by dystonia-related muscle contractions. Neuropathic pain and autonomic dysfunction. Chronic nerve pain manifests as burning, tingling, and numbness, particularly in her legs, arms, and lower back. Autonomic dysfunction-related migraines and neuralgia are frequent, triggered by temperature change, postural shifts, and sensory overload. Dystonia-related pain. Dyan has frequent dystonic storms, where involuntary muscle contractions cause severe cramping, rigidity, prolonged recovery periods. Facial, jaw, cranial dystonia leads to headaches, eye strain, and difficulty with eating and speaking. Gastrointestinal and abdominal pain. Gastroparesis, IBS, irritable bowel syndrome, chronic infections resulting in ongoing abdominal discomfort, bloating, nausea, and sharp pain. A multi-drug resistant Klebsiella UTI has led to persistent pelvic and bladder pain, causing severe discomfort, frequent urination, and reliance on pain medication strategies. Circulatory and compression-related pain. Full body, non-pitting edema contributes to painful swelling, stiffness, and difficulty wearing compression garments. Vascular issues, including venous insufficiency, cause lower limb pain and circulatory discomfort. You're in a bit of pain. Yeah? I am too. Max is attacking my socks. A little shit. Can you not?
Thanks for making me laugh, Matt.
God. He is full on. Transfers. Done. Ah!
I'm leaking.
You're leaking. Do you want a tissue?
No.
No. Ah! You got.
He hurts, doesn't he?
He bites.
He's got baby.
Right, baby shark. Dyan's ability to transfer independently is significantly impacted by 22q11.2 deletion syndrome and associated conditions including EDS, POTS, ME/CFS, dystonia, and autonomic instability. These conditions contribute to muscle weakness, joint instability, dizziness, fatigue, and impaired motor coordination,
Vertigo.
requiring varying levels of assistance for transfers depending on her daily symptom severity. A major concern affecting her transfers is syncope, fainting episodes due to autonomic dysfunction, and sudden drops in blood pressure. Dyan has frequent syncopal episodes, often without warning, where she collapses due to reduced cerebral blood flow. These episodes are exacerbated by POTS, seizures, and cardiac arrhythmias, making transfers extremely high risk. Standby supervision is essential during all transfers, as there is a constant risk that she may lose consciousness, experience a seizure, or go into autonomic crisis mid-transfer. On good days, Dyan may manage a standing transfer with standby assistance, such as moving from a bed to a seated position.
It's not really a good day, is there?
Wheelchair or toilet. However, even on these days, transfers
Good
require
hours.
careful pacing, rest breaks, and support on preventing dizziness, pain, or joint subluxation. On bad days, she requires moderate to maximal physical assistance due to severe fatigue, postural instability, joint dislocations, and increased dystonic activity. The unpredictability of her symptoms means that her support workers and caregivers must always be prepared for full assist transfers, even when she has some capacity to weight bear earlier in the day. Dyan's at high risk of falls due to poor postural control, joint hypermobility, or tonic dysfunction, and sudden dystonic movements. Frequent positional changes are required throughout the day to prevent sores, stiffness of joints, and worsening pain levels.
Some of it.
Absolutely.
Oscillating mattress, guys. So
you were talking about some dystonia not so long ago. You were talking about this was fibrillating or fluttering. It was in your foot, wasn't it?
In the arch of my foot. I couldn't get him in time because he was getting my lunch.
It just happens at any time.
And it just happened, and it was throbbing, and I literally took my sock off because I was like, oh no, it's going to cramp, it's going to cramp. It's like a cramp times 1,000. I took off my sock and I'm seeing it go do.
Absolutely, pulsing, right?
Alien.
Yeah. Frequent positional changes are required throughout the day to prevent pressure sores, joint stiffness, and worsening pain levels. Yet Dyan often lacks the physical capacity to reposition herself without assistance. Seizures further increase the transfer risks, particularly when she's experiencing loss of consciousness, postictal confusion, or sudden collapses. Given these factors, transfers must be conducted in a controlled and supervised manner to minimize injury risk. Current transfer methods and equipment. Dyan currently uses an ANSA Sonata mobile hoist with a Cressy sling for bed to wheelchair or bed to commode transfers on days when she's unable to weight bear. These transfers are currently assisted by her husband Matt, but due to his own musculoskeletal injuries and physical limitations, this is not sustainable long term.
It's even hard work with the hoist. I mean, the hoist is great. Still hard work.
Still hard work, exactly. And takes a lot more longer time.
Yes.
When Dyan has some ability to stand, standing transfers are attempted using grab rails, standby assistance from a caregiver, but these are often challenging and unstable due to her fatigue, postural instability, and risk of falls.
I still slip and fall, and I've got 2 rails next to my toilet.
Exactly.
And I still slip and fall when I'm very fatigued.
Absolutely, you can slip right off the toilet.
Massive shower chair, massive. So I can sit cross-legged on it.
Yeah.
So I can be completely safe, and then him ready to catch me.
At all times. 2-person assist transfers are required on high-risk days, particularly when pain, dizziness, or dystonic symptoms are exacerbated. 2-to-1 assist is crucial in these situations. So it basically means the OT is saying you need 2 support to do these activities safely, so that they don't hurt themselves and that you're not getting hurt.
But isn't it funny how they set these standards, which I agree with? Yeah. For staff that are paid, but you're expected to do it. I'm
doing it all by myself.
Solo.
I know, it's crazy, right?
The injuries are not covered.
Nope. This is to prevent falls and injury by stabilising Dyan during weight-bearing attempts, manage unpredictable dystonic movements, which can result in sudden loss of muscle control or severe muscle contractions, support safe positioning during hoist transfers, ensuring her body is correctly aligned, and minimising the risk of joint dislocations or skin shearing injuries. Reduce the strain on caregivers, as manual handling by a single person increases the risk of injury to both Dyan and her carer. The impact of neurological and cardiovascular symptoms on transfers. Dyan's transfers are further complicated by syncope, seizures, or tonic instability, making standby supervision essential at all times. While there are good days when she's able to manage a standing transfer with minimal assistance, the unpredictability of 22q11.2 deletion syndrome associated conditions means that her capacity can fluctuate dramatically. Symptoms such as blood pressure instability, cardiac arrhythmias, seizures, and dystonia can arise unexpectedly, causing sudden collapses, loss of awareness, involuntary muscle contractions during transfers, requiring immediate intervention from support workers to prevent falls or injuries, or picking you off the ground and fixing you once you've hurt yourself.
Yeah.
Although some predictive patterns exist, Dyan's condition remains inherently unstable. Factors such as her morning blood pressure readings, heart rate fluctuations, seizure thresholds, sleep quality, hydration levels, and behavioural indicators can sometimes provide early warnings of increased risk.
However, get irritable for a big seizure.
Even with careful monitoring, episodes can still occur suddenly, particularly when autonomic dysfunction is triggered by movement, pain, or postural changes. This means that even on a seemingly stable day, her risk of experiencing a medical event during a transfer remains high. We've got a pretty good predictability model, but sometimes it just catches me out of the blue when I'm thinking, why now? Of all times.
I think
how did that even
it's
happen?
Like, why is this happening right now? I've done everything
you cannot
right.
be content. You've just got to be
And then
alert.
I can do everything wrong, and I'm like, I'm doing great. Why is this happening? It's confusing.
Absolutely. Dyan's seizure activity is highly unpredictable and she often experiences postictal confusion, muscle weakness and coordination difficulties following an episode. Even when she appears stable, she may still require full assistance to complete a transfer safely without collapsing or injuring herself further. Additionally, dystonic episodes can occur mid-transfer, causing rigid posturing, loss of voluntary control or sudden spasms, further increasing the need for trained personnel who understand how to manage these situations safely. Another critical risk factor is her Tourette syndrome, which results in unpredictable motor tics that can disrupt the transfer process. Sudden tics can cause involuntary movements.
I have to warn carers.
Leading...
It's like, just step. I don't want to, like you say, if my arms are shooting out, I'm like,
100%.
Step back a bit. I don't want to whack you accidentally. So I warn them.
Absolutely. So, I mean, I've seen you when you had the motor tics, the leg
like,
motor tics when she's standing with her legs, and it's like so instability wise. There's a risk of accidental injuries during transfers. In some cases, these tics can escalate into more forceful, full body movements, making controlled and supported transfers essential for her safety. Because of these high risk factors, 24/7 care is crucial to ensure that Dyan is never left unattended during transfers. The presence of trained support workers at all times is essential to assess her daily condition, provide real-time intervention, and make split-second adjustments to transfer plans based on her neurological and autonomic stability.
And I go into focal aware. I hate that.
Yep.
I'm only talking about those because I have a lot of absence before a tonic-clonic, but a focal aware sucks, and that sometimes happens before a tonic-clonic. I hate it.
Absolutely.
I can't tell everyone.
No, you can't.
A big one's about to come, guys. Help me, help me, help me. I'm stuck in like a twilight zone with no words.
Well, your atonic seizures, which are known as drop seizures, I don't see I don't see a predictability pattern just before they occur, and then it's suddenly boom. You're literally, it's full loss of muscle tone, and if you're standing, it's literally everything just collapses and boom, down you go.
That's what I went, okay, I'll get a helmet now.
Yeah, absolutely. So without this level of care, Dyan faces a significant risk of serious injury, prolonged recovery times, and increased hospital admissions due to falls, seizures, or tonic crashes during transfers. Pressure care. Dyan's at very high risk of developing pressure care injuries due to multiple factors, including low body weight, prolonged bed rest, poor peripheral circulation, autonomic dysfunction, and nutritional deficiencies. Dyan spends up to 23 hours per day in bed, which increases the likelihood of skin breakdown, pressure ulcers, and musculoskeletal pain.
Can I explain the reason for malnutrition too?
Yeah, go for it.
There's two reasons. Gastroparesis causes malnutrition.
Yep.
There's nothing we can do about it. We all do our best. If you've got gastroparesis, you know what I'm talking about. Second, I have arthro because of autism. Yep. I'm particular with what I eat. It's problematic in behavior because if I only eat certain things and I'm not getting a well-balanced diet, then I'm going to have my blood test be malnourished, even if I'm eating, even if I'm in healthy weight range. ARFID,
which is avoidant restrictive food intake disorder.
Maybe we should do some more videos on that where you force me to try new things.
Oh, could you imagine?
Watch me be a super bum.
Given the progressive and systematic impact of 22q, which affects muscle tone, autonomic stability, and connective tissue integrity, Dyan requires intensive pressure care management to prevent further deterioration and hospitalisation. Without adequate pressure care relief strategies, her ability to meet her NDIS goals of increasing independence and participating in her community is significantly compromised. Findings.
So if there's an apocalypse, I'm screwed.
You're screwed. You can be the Walking Dead though. You'll probably do good as a zombie.
Hey.
Just saying. Findings from the clinical nursing assessment. The clinical nursing assessment identified fragile skin integrity with small red pinpoint lesions on her back, which may indicate an allergic reaction, early stage pressure care injury, or circulatory compromise. Dyan also experiences full body non-pitting edema, likely caused by autonomic dysfunction, circulation issues, and medication effects. Dyan has chronic scoliosis and lower back pain, which requires ongoing pain management, increases her risk of developing pressure-related discomfort. Her Waterlow pressure risk score is 21, categorizing her as a very high risk, you can't get any higher, very high risk for pressure ulcers. While no active wounds are observed, consistent monitoring, preventative interventions, and appropriate equipment are essential to avoid further skin breakdown. This is why you have a level 4 alternating air pressure care mattress here and on your wheelchair.
My skin on the back side of me went black.
Yep, absolutely.
My skin died.
Yeah.
And I was not educated on it, warned on it. I was being neglected. I'm still being neglected by the health system, but you know, And the nurse that I had helped us
to
get through
learn
it
and work out strategies around it all.
And it was a long time to heal.
Correct.
And now we have preventative measures like
Speaking of which, current pressure care
this.
strategies. Dyan currently uses a Duracell A4 pressure care mattress in conjunction with an ANSA 4-section high-low adjustable bed to reduce pressure build-up, support optimal position, and facilitate safer transfers. She uses a Roho cushion for her wheelchair, providing pressure relief and postural support to minimise skin breakdown. Frequent repositioning is critical to preventing pressure injuries. However, this is primarily managed by myself, who already experiences significant musculoskeletal strain. Additional formal support is required to ensure safe and consistent repositioning without further burdening her primary carer. Compression garments are used to support circulation and manage edema, but these require replacement, which needs ongoing funding. What are the risks of not having sufficient support? Well, without 24/7 support for transfers, Dyan's at a high risk of serious injury, medical deterioration, and increased hospital admissions. Her unpredictable neurological and autonomic symptoms, including syncope, seizures, dystonia, blood pressure-related instability, mean that she can collapse, lose awareness, or experience involuntary muscle contractions mid-transfer, increasing the likelihood of falls, joint dislocations, and significant injuries. Even on days when she appears more stable, her condition can change suddenly, making standby supervision essential to ensure safe transfers and prevent medical complications. Without adequate support, Dyan may be unable to reposition herself, access the toilet safely, or manage essential daily activities, impacting her hygiene, circulation, and overall well-being. These challenges directly limit her ability to progress her NDIS goals, which focus on increasing independence, accessing the community, and improving daily function. The lack of formal transfer support also places an excessive strain on her primary carer, Matt, who is already experiencing physical injuries and caregiver fatigue, making long-term informal care.
How heavy am I after a seizure?
You're a dead weight.
Yeah.
You
much.
literally are a dead weight, which
I
is
can't help
difficult
him
to
many times
move in position.
of these events. I can't be assistive to him.
No, and that makes my ability, for care unsustainable and unsafe. So without trained assistance, the risk of falls, delayed emergency response, and preventable hospital admissions increases significantly. Ensuring continuous skilled support for transfers is essential to reduce injury risk, maintain Dyan's functional mobility, and support her ability to engage in daily life safely with dignity while actively working towards her NDIS goal. If she can't keep moving, then she's going to deteriorate even further. If she doesn't get to have social life and connection, you don't feel part of the community, you deteriorate in your mental health.
They don't have places to go anymore. That's what they've also failed us in.
Personal ADLs, activities of daily living, and transfers.
Yes.
Showering. Dyan faces significant challenges with showering independently due to the combined effects of 22q11.2 deletion syndrome and associated multiple complex health conditions. Symptoms such as severe fatigue, dizziness, muscle weakness, unpredictable dystonic episodes make showering a physically demanding and often risky task. Quite commonly, we can go into a heart attack and other sort of events because of having a shower. We actually have nitrolingual GTN spray in the shower ready to go to deal with that. We actually have crash pads immediately outside of the shower so that we can collapse Dyan onto that. Autonomic instability further complicates the process as changes in temperature and exertion can trigger blood pressure drops, post-exertional malaise, PEM, or even seizures, requiring close supervision and assistance to ensure Dyan's safety. Maintaining proper hygiene is essential for preventing infections, including recurrent urinary tract infections, UTIs, which Dyan is prone to due to her autonomic dysfunction and continence challenge. And that's actually consistent with patients with 22q. You have a higher precedence of having UTIs. Dyan has a history of multi-drug resistant Klebsiella infections, making consistent perennial hygiene crucial to avoid worsening symptoms and additional hospitalizations. Current showering supports and challenges. Dyan relies on assistive technology and caregiver support for all aspects of showering due to severe fatigue, pain, and thermoregulatory difficulties. She has a Windsor walk-in bath, but has not been moved at that time to the current residence. It's now in place. So that's cool. Showering is exhausting and often triggers post-exertional malaise, leading to extreme fatigue, increased pain, blood pressure instability, in some cases seizure inactivity due to the autonomic stress. The process of bathing must be carefully paced to prevent overexertion and autonomic distress. We can sometimes take 2 hours for the whole process of doing your showering just to keep you safe.
And then by the time that's done, do I want to go out?
Yep.
I'm exhausted.
You're exhausted. That's your activity for the day,
that's
right?
my activity.
Yeah. Dyan also has difficulty regulating water temperature, placing her at risk of burns or overheating due to dysautonomia, affecting her body's ability to detect and respond to temperature changes. Overheating after a shower is a frequent issue, triggering blood pressure crashes, dizziness, and syncope. To mitigate this, the bathroom door is kept open to prevent heat buildup, as her apartment is maintained to a stable 23 degrees to help with thermoregulatory impairments. Dyan requires
I don't have hot showers anymore.
one-person assistance for all showering tasks, though her level of dependence fluctuates. On better days, she may be able to wash her arms and the front of her body, but on worse days, she requires full assistance for washing and drying tasks, including her hair, lower back, and body. There are also days when two-person assistance is required to ensure the process is as efficient and safe as possible, as she cannot tolerate prolonged time in the shower. To manage autonomic distress, GTN sprays and specific ointments are placed in the bathroom for easy access in case of a sudden medical event. Dressing and grooming. Dyan requires varying levels of assistance with grooming and dressing depending on her daily fatigue levels. Pain severity and postural stability.
I've gone backwards, guys. I've gone backwards. Like, I've regressed to the point where I've always found it hard to dress myself. I do admit that, but I have actually got worse.
Due to the impact of 22q and other associated conditions, dressing and grooming tasks can be physically demanding and require careful pacing and support. She generally completes most grooming and dressing tasks while seated in bed to conserve energy and reduce the risk of falls. On better days, she may tolerate using the vanity basin for short periods, but this is dependent on your postural stability and fatigue levels. Grooming. Dyan completes most of her oral and hair care tasks here.
Yeah, I brush my teeth in bed.
In bed and in the shower, since standing at the vanity is often way too exhausting. She requires assistance setting up the personal care items such as toothpaste, toothbrush, deodorant, hairbrush, as fatigue and joint pain limit her ability to retrieve and manipulate small objects. She's unable to tie her hair up and needs assistance with styling and maintaining her hair. She does not use additional grooming equipment, and trimming her nails requires assistance due to the pain and reduced dexterity in her hands. Support workers or Matt assist with shaving when necessary, and Dyan's grip strength and fine motor control coordination are insufficient to complete this task independently and safely. You can cut yourself up, can't you? Dressing. Dyan follows a structured dressing routine, beginning with a rest period before dressing. That's why we use the dressing gown, literally, so that you can come out of a shower, put the dressing gown on, and lie down to recover before we start dressing you.
Staged. Even though there's a chair in the shower, I have to still
everything
do
steps
all
up to 2 hours
stage,
just to do showing, right? 2 hours.
Stage 1, stage 2, stage 3.
So Dyan
stage
generally
4,
dresses
stage 5.
while seated in bed to conserve energy and avoid excessive movement that can trigger dizziness or syncope. On good days, she can dress herself except for the socks and shoes, but on bad days, she requires physical assistance for dressing her lower body. Dyan experiences shoulder pain and frequent dislocations, which interfere with her ability to put on shirts and jackets. To mitigate this, she wears loose-fitting clothing that reduce strain during dressing. Due to joint instability and finger pain, she struggles with buttons, zippers, prefers elastic waistbands and slip-on clothing such as pajamas. Dyan's ability to manage grooming and dressing independently is highly variable, requiring daily assessment of her energy levels and physical symptoms to determine the level of support needed. Ensuring structured assistance and pacing strategies is crucial to maintaining her comfort, hygiene, and ability to engage in daily activities. Toileting. Dyan requires comprehensive support for toileting and continence management due to her complex medical conditions. She experiences frequently urinary urgency, incontinence, and functional challenges resulting from ME/CFS, POTS, and EDS, and relies sometimes on self-catheterization and a combination of medications and continence aids to manage her bladder and bowel functions. Chronic constipation requires the use of laxatives, enemas, and suppositories, leading to frequent and exhausting toileting. And colonics. Pelvic prolapse adds to discomfort, particularly in the evenings when fatigue is pronounced. Dyan needs assistance with transfers to and from the toilet, particularly at night time, cleaning and maintaining hygiene due to the muscle weakness, joint instability, and pain. She requires support staff to monitor the continence, manage equipment, and ensure infection control through proper hygiene practices. The need for a level access bathroom, raised toilet, and assistive technology like grab rails is critical to enhance her independence and reduce the burden on her primary carer. Because even when we go into hospital, we have to make sure that we get a Zimmer frame to put your feet up on the toilet. We have to assist you to and from. There's so many steps and all this. You've got to wear non-slip socks so you don't fall out when you get out of bed, etc. So for continence, there's bladder management related stuff, bowel management related stuff, incontinence episodes, community toileting needs, nighttime concerns. All of these things are separate and listed. I won't go through them all. Then there's also a clinical nurse assessment that covers everything in a 50-page document. Eating and feeding. Dyan experiences significant dietary challenges due to the multisystemic effects of 22q11.2 deletion syndrome, and gastroparesis, dysphagia, or tonic dysfunction, chronic fatigue. She's been under the care of the dietitian for several years. She has a low FODMAP gluten-free diet consisting of fresh whole foods, smoothies, soft meals to support gastrointestinal function and prevent exacerbation of symptoms. You have what's known as oral stage dysphagia, characterized by orofacial weakness, reduced tongue coordination, and difficulty in controlling the food
I
bolus.
have a high palate.
Swallowing
And my
is
tongue
effortful.
can't reach everything.
No, and the
It's
fatigue
hard.
impacts your ability to chew thoroughly, increasing
It
the
just
risk
goes
of
down.
choking and aspirational pneumonia.
I always choke.
So Dyan must follow safe swallowing strategies, including
Nothing
sitting
works.
upright, small bites and sips, and remaining upright after eating.
Nothing
Due to gastroparesis, she struggles with delayed gastric emptying, causing early satiety, nausea, bloating, and difficulty consuming large meals. To manage symptoms, she follows a small, frequent meals approach, consuming most of her food between 3 and 10 p.m. when her digestive function is most tolerable.
I've changed that back again
Yeah.
to forcing myself to eat throughout the day.
You're doing really well with the pacing,
Yes.
and your diet's working
Like it's
extremely
lighter
well.
meals, but many, many more.
But a lot of work.
That's fine.
Yeah.
So I'm
Aspiration
pretty much like a cow
and
in a
safe
paddock.
eating.
I have to just keep chewing.
Moo. You?
I'm a cow.
Dyan is at high risk of
love
aspiration
cows,
due to
they're
reduced
cute.
airway protection, oral residue post-meal, and frequent fatigue-related swallowing difficulties. Safe eating strategies include, and they list all the different safe eating strategies. Support needs: full assistance with meal preparation, support workers assisting with meal setup, ongoing dietitian reviews, and monitoring for aspiration risk. Without consistent nutritional support, Dyan remains at risk for malnutrition, aspiration and pneumonia, and further physical decline.
I
Addressing these
aspirate
challenges
once a week.
is critical for maintaining her health, energy, and ability to participate. Then it goes into sleep. Dyan experiences
borderline
sleep.
narcolepsy.
severe and persistent sleep disturbances, all due to the combined effects of 22q11.2
Did you know
deletion
there's a
syndrome.
connection to Tourette's? 80% have sleep disorders.
Correct. Did you know that? I knew that. Absolutely.
I've got a sleep disorder and Tourette's.
A lot of
Interesting.
neurological issues
Yes.
are associated with sleep
Yes.
disturbances, right? And 22q is a known sleep issue. Dyan has
Right.
extremely poor sleep quality, insomnia, sleep anxiety, bedtime
Yes.
resistance, night waking, daytime sleepiness, narcolepsy, significantly impacting her ability to function during the day. Studies on 22q deletion syndrome indicate that individuals often experience a higher prevalence of sleep disorders, including insomnia, sleep distorted breathing, abnormal circadian rhythms, which can contribute to cognitive and emotional dysregulation the following day, referencing O'Hara, Skiffler, and Buridan 2023 research. I love them when they do their research and have references. Sleep disruptions. Dyan's sleep quality is profoundly affected by multiple medical complications. Despite adhering to structured bedtime routine and implementing effective sleep
I
hygiene
have a
practices,
good
such
sleep
as
hygiene.
utilizing white noise machine, controlling room temperature, blue light filtered glasses, her sleep remains fragmented. Severe joint pain, dystonic movements, or tonic instability, frequent
Correct.
delayed sleep onset, sometimes keeping her awake until the early morning hours of 3 and 4 o'clock in the morning. On such nights, even minimal sleep or rest does not prevent early awakening due to the discomfort. Additionally, her sleep history includes parasomnias, sleepwalking, and nocturnal neuresis. These disturbances are compounded by obstructive sleep apnea when supine, lying on your back, cataplexy episodes triggered by drowsiness or emotional stress, further undermining her ability to achieve restorative rest. Notably, respiratory assessments reveal oxygen desaturation to 83% during sleep, highlighting potential and worsening sleep apnea. Given that sleep disordered breathing is prevalent amongst individuals with 22q, such nocturnal hypoxia poses risks of exacerbating daytime fatigue, cognitive decline, and emotional volatility. The impact of poor sleep function and daily living. Sleep disruption significantly diminishes Dyan's neurological stability, aggravating episodes of seizures and dystonia. Existing research indicates a strong link between sleep deprivation in individuals with 22q11.2 deletion syndrome and increased attention deficits, impaired executive functioning, emotional dysregulation, autism. These challenges manifest in Dyan's daily life as persistent fatigue, cognitive sluggishness, impaired motor coordination, and a heightened risk of seizures. The S word. Her
I
inconsistent.
don't like not sleeping because it triggers that or dehydration.
Bingo.
Or lack of food.
Her inconsistent
heat.
sleep patterns result in fluctuating daytime functioning, hindering her ability to engage in structured activities and therapeutic sessions. The cumulative effect of these impairments severely restrict her independence, and disruptive sleep cycles in individuals with 22q are closely tied to diminished executive functioning. Targeted sleep interventions are therefore critical, not only to stabilise her neurological symptoms, but also to enhance her overall functional capacity and participation in personal therapeutic pursuits. Impact. Sleep disturbances also have significant impact on me, primary and formal support, and that's what contributes to me getting sometimes only 3 or 4 hours of sleep per night. And obviously sleep can be fragmented, as I'm constantly on alert to Dyan's needs and potential medical emergencies due to insufficient formal supports. Matt is the one who monitors breathing, helps reposition her during dystonic episodes, and responds to seizure activity or tonic crashes overnight. This prevents me from ever achieving deep, restorative sleep, contributing to my own chronic fatigue, stress, and physical strain. So, without additional formal overnight support, Matt's ability to continue in his caregiving role is becoming unsustainable, further increasing the risks of both burnout and gaps in Dyan's essential care. It goes on to explain about medications. Then we're talking about house management, instrumental ADLs, that you require full assistance with household management, daily tasks, personal care during the day, and any of these things has further impact upon you. House management support that includes doing the dishes, the laundry, pet care, general cleaning, mail collection, monthly management. That's why we need support doing daily cleaning, don't we? Vacuuming, dusting, mopping, whatever.
Well, we've actually, our carers are going to be lucky because we've actually hired
a cleaning agency,
so that they can focus on the caring because of my complexity. I think that's fair.
Well, it is fair because they are essential.
If I wasn't so complex, then they should be able to do housework.
But why is it essential? Because it prevents infections, skin
Correct.
irritation, sensory overload.
Correct.
They're common challenges for individuals with 22q, 11.2, Deletion Syndrome,
as you guys see
Autism,
me
and
before,
MCFS.
Sorry, not before a shower. After a shower, you'll see me do my regime around my little area here.
Yeah.
I will disinfect it myself after a shower when I'm clean.
Yeah.
You know, to keep like that daily cleanliness in my zone particularly to prevent that. And then my cleaner does that throughout the house. She's NDIS aware, she's disability aware, and she knows that for my immune system, it has to be clean.
And for you to try and participate causes you pain or reduces your own energy.
She doesn't expect me to.
You're
she
exhausted.
Just comes, she likes to have a chat.
Other things that have to be done, you need complete support for doing the laundry tasks,
yes.
shopping and community access tasks, meal preparation and nutrition. That means going shopping, preparing it, and serving it and cleaning up after those effects. Financial management, it also goes into, because of your cognitive impairments, you need support for paying the bills, doing the budgeting,
yes,
etc. Managing appointments and medical administration. Again, because of fatigue, memory, and cognitive challenges, I have to do all of those things as well.
I've declined in my cognition and...
Your community engagement is significantly impacted by your complex disabilities.
Correct.
And explains all of that. We hope to use more hydrotherapy, particularly in summer, to build up your strength and integrity. Communication, it goes into. Dyan's communication abilities are influenced by autism, ADHD, cognitive challenges. While Dyan is verbal, she experiences difficulty expressing emotions such as pain, frustration, fear, anxiety due to alexithymia and interoception. Her capacity to understand and express herself can also be impacted by fatigue, pain, and anxiety. These factors necessitate specialised communication strategies to ensure effective interaction and support. So it goes on to explain your verbal communication, your use of the augmentative and alternative communication device, your processing needs, auditory processing, and the time for responses, and the computer
and this is based
strategies.
On, like, you know, my OT was given like my neuropsych assessment and all this, which was
extensive.
A 15-hour extensive test.
Extensive,
so, you know, that's helpful.
Correct.
But I do find, I think all SDAs should have a pool, really, because hydrotherapy, I'll have to advise that to anyone whose doctor says you can. I highly recommend it because it's one thing that I feel stronger in summer than I do in winter. I don't have the energy, sadly, to go to a public pool in winter, otherwise I would. But I'm just saying, like, I am just so grateful to have a pool because I do improve.
It's life changing,
in summer,
really, isn't it? It makes such a huge difference.
Yeah,
I agree.
and it's safe in the water.
And it's only safe because there's no weight bearing loads.
Yeah, you're not like cardio.
Bingo. Your other communication challenges include vocal outbursts, so because of Tourette's, vocalization, coprolalia,
Meltdowns.
sensory overload, so exposure to
Sensory
loud
overload,
noise or
yeah.
sudden movements, misinterpretation of social cues because of autism as well. So those things. Cognition, you've got cognitive functioning related issues. Now, there's been, as you said, formal neuropsychological assessments that reveal that your working memory is well lower than average. Processing speed, cognitive limitations, again, because of 22q. So that affects your memory,
Well, did you
language,
notice it said
visuospatial
that?
ability.
She said with 22q, I want, make sure everyone slows it all down.
Slows it
Didn't
down.
she say that?
Absolutely.
Yeah.
And you've also got cognitive fatigue, significant cognitive fatigue because of having 22q11.2 deletion syndrome and severe myalgic encephalomyelitis chronic fatigue syndrome. And cognitive fatigue manifests as mental exhaustion following just even the most simplest, smallest little things. So it's further exacerbated by your neurological conditions, resulting in slower processing, reduced attention spans, difficulty retaining new information, and prolonged cognitive engagement can lead to increased recovery periods, significantly affecting your ability to participate in daily activities. It goes on to explain your learning abilities, specific cognitive challenges such as Tourette's, noise and movement, autism spectrum disorder, memory and cognitive confusion, social vulnerabilities, learning disabilities, executive dysfunction, psychological stress and PTSD, meltdowns and safety concerns. And there's a whole range of support strategies around all that and assistive technology. Standard assessments have been done on Dyan by the occupational therapist. So the World Health Organization Disability Assessment Schedule 2, the HUDAS, was performed to measure the disability across 6 domains of functions. Dyan's levels for cognition, 83.3% extreme impairment. Mobility, 90% extreme impairment. Self-care, 87.5% extreme impairment. Getting along with people, 60, moderate impairment. Life activities, 87.5% extreme impairment. Participation in society, 90.63 extreme impairment. Your overall score is 83.16% extreme impairment. Your HUDAS reveals extreme impairment across all domains of functioning.
Makes me sad.
The caregiver burden scale was something which I was tested upon to see how I was going with that. I scored 76 out of 88 on the caregiver burden scale. That's a severe level of caregiver burden. In my own words, I feel beyond exhausted, physically hurting, hard to catch my own breath, heart pounding, head aching, swollen ankles, sore joints, torn ligaments, distressed, depressed, defensive, lacking quality sleep, eyes that don't focus, and a mind that's racing. It gives you an insight into the impact of continuous high-level caregiving that's had on my own health and impact. And it goes into a whole range of other things pertaining to that. There's also a care and needs scale, which is known as the CANS assessment. That provides a structured assessment of an individual's level for support requirements. Now, while it's originally designed for individuals with traumatic brain injury, TBI, its framework is highly relevant in assessing Dyan's complex needs due to 22q11.2 deletion syndrome and associated neurological, autonomic, and functional impairments. Your score is a 16 out of 28, which is at a CANS level of 7, indicating that you cannot be left alone. You require 24 hours a day care and supervision and medical oversight. Make sense? Okay. Your condition is characterized by severe cognitive, autonomic, and mobility impairments, which profoundly impact your ability to function independently. And there's clinical considerations that it goes into: high risk of syncope, falls, cardiac, immediate interventions to prevent injuries or medical complications, assistance in meal preparation, modified diet, monitoring for aspiration, constant monitoring to prevent serious complications. So given the complexities of neurological, autonomic, functional needs, Dyan's assessment reinforces the critical necessity for supported independent living. SIL, okay, remember, supported independent, not ILO, SIL, there's different types of support.
Yes.
That's 24/7 supervision, structured support, medical oversight to maintain safety, dignity, and quality of life.
Yes.
So that's all the CANs. There's risk of insufficient support and justification, and it's well documented what the physical risks are. Life-threatening. Okay, there's safety and judgment assessment. That was actually a very interesting one because sometimes we become not so aware of our own risks to do with safety and judgment. And it went through a whole range of different questions. What number do you call in an emergency, such as a fire? How do you know if the milk is off? Explain what you do to cross the road safely. What would you do if you spilled a hot cup of coffee? What would you do if you had a bad fall? What would you do if your bread got stuck in a toaster? Whole range of actual life experiences. If someone knocks on the door, or you're facing an intruder, you get a call from someone saying that it's your bank and they're asking for your PIN number. Real life scenarios.
Time I tried to do my banking in the lockdown because I had to change a mobile number because we changed from Vodafone, which was just turned really bad, and so we went to Optus.
Yep.
And I had to change my bank mobile number, and they locked me out. They said you're impersonating
as if you're coming across as someone.
Security. I mentioned this call, and I said, well, I warned you at the beginning.
I'm
I
a
have
person with disability.
Problems, and I've got a disability. So, yeah.
Going through that questionnaire was very insightful, also for myself, and even your own GP, your primary care physician, who's known you for 8 years, who read through that and goes, "Oh shit."
Yeah, well,
he said, "Oh shit."
He doesn't come for home visits, so he doesn't really see.
So seeing how you manage with real world situations was insightful of the concerns, and again why Dyan needs constant, high level, high intensity support, needs 24/7 monitoring. Safety awareness and risk management deficits, impaired executive function and decision making, high dependence on carers for daily living and management, emotional dysregulation and stress response, financial and vulnerability risks. You're just high risk of everything. You're high risk of injury, self-neglect, and prolonged distress in emergencies. You've got limited ability to adapt to situations. You've got increased vulnerability to environmental hazards, and you have heightened stress response and emotional shutdown in crisis. Okay, so yes, it goes through all of that information as well.
Surely that's it. No, it keeps going.
It's justifications of why you need all the supports. You know what? You have to go through so much and ratios and every single event, every type of event, day or day of night.
You have to remember, this is why, even if you can, you might be this bad yourself, or you know someone this bad, or even if you're not this bad, look at the time they've made me wait since January. And this is my OT report from all of my specialist reports that she's pulled together, her own research. This is the situation that my carer is in, that I am in, and they have been well known about my situation since January, and I'm still waiting.
Correct. And look, you've been on the NDIS for 6 years. They've done change of circumstances every 6 months during that period of time.
They have apologised.
They know. They've apologised reverently towards you.
But in my eyes, I'm pretty harsh now because I've had to, and it's nothing personal to anyone that crosses my path, but any mistake for me in my life going forward from, I guess, like not so long ago, since I got so severe, could cause my death.
Absolutely.
And I cannot afford to just be people pleasing anymore.
No, you can't.
I have to lay down a line and say, this is my line of acceptability.
That would be irresponsible to do so. Absolutely. And look, the last part of the report goes through to say that Dyan needs the 24 hours a day support.
Yes.
Assistance with social and community
and I
participation.
Don't disagree.
Transport
I used
funding.
To disagree.
Consumable budgets. Continence budgets. Because again, how does a person without support or funding access the equipment or the medical things? Capacity building, occupational therapy, physiotherapy, speech therapy, psychology, continence management. I mean, it goes in such detail to outline all of these things that are actually necessary. Clinical nurse to do all these things, specialist support coordination that's required, AT equipment, and also the management and repairs of those.
We found a very good support coordination company, guys, which specialises in medically complex people.
Yeah.
So all of the people
pages.
that are support coordinators, specialist support coordinators in this firm, are basically all from a health practitioner background.
Yep.
Fantastic.
Yep.
And
Registered nurses.
in the medical side of it, more
Yep.
so. Yes, there is one, he's a psychologist, but for me, I'll be getting the registered nurse because naturally mine's heavily medical.
Yep.
Psychosocial with my autism, ADHD, whatever else, OCD, is not so much the focus for me.
That's
it's
not
the medical.
the life-threatening critical care needs stuff.
I mean, it's there's safety issues
Yep.
in it, yes,
Absolutely.
but basically, yeah, the medical. So we're very lucky to
Absolutely.
find that. It's quite close by to us, which is another lucky thing.
Yeah. As I said, 74 pages just for the functional capacity. Then there's a clinical nursing report, a continence nursing report,
And the
all these
clinical
other
nursing
reports as
report
well.
was very thorough
Oh.
too. So I highly recommend getting a clinical nurse.
The
having
clinical
an
nurse report
assessment,
particularly
having
goes
it written
into everything 20,
all of it matters.
422q11.2 deletion syndrome. It
Yeah.
absolutely references and quotes everything that's expected with the condition of having a
Well,
micro
nurses
deletion,
know.
missing 30 to 50
I think
genes,
nurses know more
3
than
million
doctors.
DNA building blocks. And look, they've taken the time to read. They've actually taken the time to resource and reference
Yes.
all of the
Very
medical
much so.
journals and clinical guidelines. This hopefully will give you an insight with what we have to deal with when we
What do you have to do
apply
when you're,
for the
under
NDIS, National Disability Insurance Scheme,
Mhm.
and when you're going through changes of circumstances to access the supports for your person. And it doesn't just look purely at the person, but also
And
the informal supports,
yeah,
the carer, the
yeah.
partner, how the impact occurs, because there's such an over-reliance on that informal supports, and it causes people to become injured, to become mentally exhausted,
It's not
physically
right.
drained.
It's abuse
it's
of
incredible.
the public, really,
Mm.
because you don't get paid for
Yeah.
it. A carer's pension does not cover
Yeah.
the needs that you've
Yeah.
had, and and also, it's for us. It's not a situation of he could go to work, and that would put more pressure on them to do so, because I could die any day.
Correct. You miss out
Why
on
would
that.
I want my partner away when I don't have my elderly years? I don't have that.
No.
I don't have that.
Patients with
This is it
22q
now.
are 3 decades older because
Yeah.
of the condition. So Dyan's 51. Think of it as her being 81 years of age because of the complexities of the health conditions that make her appear and act as a person who's a lot older than she actually
And then here
is.
I am with a low mental age. Oh my god.
I know you got the other end of the
Make that
spectrum
make
for your
sense.
capacity and neurologically and mentally as well.
So,
It is such a challenge. Now, also supporting this are reports from Dyan's primary care physician of 8 years, also multiple specialist reports, and an
he sent a lot
escalation
of
from the
to
hospital as well.
He's ripped him a new
There's a
one.
geneticist report, gastroparesis through the
mad.
gastroenterologist, rheumatologist
Yeah.
reports, neurological reports.
Yeah, so
So many other reports come into
so
this
much
whole
coming
support
together,
as well.
yeah.
But this was all submitted in January. We are now mid-September and we are waiting desperately, urgently on this. But it
It's
gives you
pretty
the
bad.
indication
It's
of,
pretty bad.
even when an OT who
It's
is
neglect to
highly
you,
trained,
and it's
4-year
neglect to
experience
me.
in her training, very well experienced in the industry,
She's
has
very
outlined
good, actually.
the heightened risks that Dyan goes through. We can
Yeah.
sometimes be a little bit complacent with it all. We can sometimes
We
put
get
on a
used to
smile
it,
and
yeah.
just battle through.
No, but I think it's we switch off to the risk
We do.
factors. Because if you think about it too much, then
Oh.
you're just going to get depressed.
Correct.
And we've always had that mentality. So in raising our children and all the tough times you go through, you banter to each other to get through.
you do,
And I
exactly.
think that's what we've always done. But it's true. The sad fact is, though, my life can be like that.
Correct.
And so it's really, I think more so for you,
Yep.
it's really
It is,
stressful.
it is stressful, absolutely.
And it's not healthy for you to live like this.
No, and look, even though we've got our SEMI-3 camera that's monitoring Dyan, we have a night watch, which is a wearable device in
But you
case the
still
heart
can't
stops.
sleep. You
There's
still can't sleep.
alerts for pulse or something.
Yeah.
There are, you don't go to deep sleep. You're always on a light sleep because even the sligest
If
movement,
I put my oxygen
choking,
thing on,
whatever else, I'm awake and ready to
If
go.
I put the actual heart rate and oxygen one on every
You'll
night,
be alarming every night.
the alarms would be going off all night. You get no
Correct.
sleep.
I would get no sleep. That's
So we
the
can't
reality
actually
of the
do that.
situation.
Even though
Which is meeting Met-Call standard
now
levels
we
for
can put it
emergency
on and
medical
turn
team
everything
involvement.
off
Yep.
and just put the report I print
Yeah.
off the report the next day for the
Yep.
doctors, etc.
Yep.
But yeah, I'm just saying, like, it's
But
just
quite commonly, I'll wake up
hard.
to Dyan having dystonia, or having a seizure, or having tics, or literally having chest pain, or being breathless and cyanotic
Insomnia sometimes.
and blue lips. It's very stressful. But look, I'm hoping that today has given you a bit more of an insight into who Dyan is, what she's dealing with,
Just
what
the
her functional capacity of her
complexities,
complex condition of having a genetic chromosomal umbrella condition, which then shows all these other sub conditions
And this is how
underneath it
bad
all.
the system is with caring for us. As much as I'm grateful for the system, I'm never going to say I'm not.
Yeah.
And I feel
It's
still
getting better.
blessed, even though I don't have my needs met. But I am pretty disgusted that I'm in this state for 9 months because of them not doing an urgent change of circumstances. I'm pretty disgusted. I think that we can do better.
We need to do better.
As a country for
a lot of participants don't have a partner or informal support or a mother or whatever else who's supporting them and working their way through the system. I'm exhausted
families leave.
Dealing with the paperwork, the phone calls, the meetings, just to escalate or get the reports done.
If you have family that have stuck by, you're very lucky, and that's great. And I really want that for most people. And I think we actually need to improve that. I actually think that family needs to be, and really from the government down, the government needs to start to say,
recognised, acknowledged,
the whole
supported.
family needs to step up. We can't.
Encourage.
That needs to come into the affordability of the future of the system. I'm sorry, but that's just the fact.
Give them the resources to do so.
And I know, as being a
Give them
mother
the training.
myself, if my adult sons got sick, even though I'm disabled, I would do whatever I could to help them, even though I'm disabled. So I think that as much as the NDIS system is needed, I'm not denying that. You all need it, we need it. But I think that we all need to take some self-responsibility in being there for each other as well.
And look, remember too, we were self-funded. We did all this ourselves for 25 years straight. And it got to a point where it was even too much, even for myself, with my background knowledge, training and experience, to be able to handle it.
Most people would not have done what we did.
No, absolutely.
Most people just can't handle that. And it did break our family.
Absolutely.
My children, I believe they have PTSD.
Absolutely, I agree.
And that's why they're staying away. And it's just a situation that the government left me in.
Correct.
And then they affected you. They affected our children. And I will always blame the government for that, because they late diagnosed me
100%.
with multiple presentations of serious things, and basically I just think that it's a huge failing.
It's about 87% of people in your situation who don't have long-term relationships, partnerships.
I can imagine. I wouldn't blame you for walking away.
You know what I mean?
I would not blame you, because this is crap.
It's unacceptable, the lack of support.
It's crap.
Guys, please, a big thumbs up of encouragement. I'm sorry this is a longer than normal video,
smiling,
but it gives you an insight. I'm sorry I spoke so fast too, but I had to just to get through, otherwise I'll be here for 3 hours.
But I want to give people hope. Look at my situation and how I'm not getting my needs met. We have to still keep this, okay? I know that you have to keep filling out your paperwork, keep seeing your OTs, your doctors, your specialists, keep doing all these things, but and keep pushing at the NDIS for your needs to be met, because you have that right.
Ask for help.
But just stay above it mentally, because no one else can do that for you but you.
That's exactly right.
And it's really important, because you're not alone.
No, exactly.
You're not alone.
So speaking of which, if you've got comments, questions, ideas or suggestions, leave them below. We'd love to hear from you about your own journey, accessing disability services in your country, or working or dealing with the NDIS, or what you thought through the functional capacity assessment done by the OT. If you're new to the channel, don't forget to subscribe and hit that notification button. Please, as usual, share our channel so other people can also find it. And we'll see you in another episode real soon. Bye for now, guys.
Bye.
Thank you.